My name is Karl Cooper. I am an attorney originally from Philadelphia, and I've been told I talk very fast on these kind of things, so I will try and watch my speed so that people can follow along with what I'm saying. But just a little bit of background on who we are as an organization. As Joey mentioned, I'm a person with a physical disability myself, and our organization, American Association on Health and Disability, work on serving people with disabilities, specifically with our mission of promoting health and wellness for people with disabilities. That is cross disability, so it includes physical disabilities, intellectual disabilities, mental health, developmental disabilities, the whole, all phases of disabilities and all types. It also includes across the lifespan as well, so not just adults with disabilities, but also children with disabilities and older adults with disabilities. So we do this through 5 main objectives that we have as an organization. We work to reduce health disparities. We advocate for community inclusion. We promote full accessibility in healthcare settings. We work to integrate disability into the public health agenda, and we advance knowledge translation and disability research. One of the ways our executive director is fond of saying it is we look for sort of some of those programs that are maybe initiatives that are aimed at improving people's health, and where are people with disabilities falling through the cracks, and trying to make sure that those cracks are filled so that all people are included and people with disabilities can be fully included and integrated into public health and other health and wellness initiatives. If we're going to talk about doing outreach to the disability community and specifically how it's affected in COVID, then we need to know a little bit about the audience. So I do want to take just a brief moment and talk a little bit about the disability community and who they are and sort of what exactly makes up the population. And no surprise, there are significant health disparities for people with disabilities. Now, a common question that I will get, especially as an attorney, when it comes to disability is, well, how do you define disability? And the truth of the matter is, there's no real easy way to define disability. There's multiple ways you can define it. There's multiple ways it's defined in federal statutes. And depending on how you define the term will determine how many people with disabilities exist in this country. So there's all types of, so if you hear different statistics on the number of people with disabilities, it's for good reason. It's because it's depending on how you're defining the term. You'll have, for instance, a federal statute like Social Security disability, which is going to define it very narrowly for good reason, because you only want those who really need those benefits to receive them. But then you'll have other federal statutes like the Americans with Disabilities Act, where you want it to be as broad as possible and help as many people as possible. So that will be an even broader definition. If you hear the term, if you hear the statistic 1 in 4 or 1 in 5 people have a disability, it's that broader definition that people are usually talking about. For purposes of what I'm going to be talking about today with the statistics I'm going to be going over, we're talking about one that's not quite as restrictive as, say, the Social Security disability definition, but is more restricted than, say, the definition under the Americans with Disabilities Act. And in this instance, we're talking about disabilities which seriously limits an individual's activities of daily living. And according to HHS, that comprises about 12.5% of the population, or 1 in 8 people. And for this particular statistic, or for this particular group, I should say, there are some interesting statistics as it relates to their health. People with disabilities are over twice as likely not to see a doctor due to cost. They're over 30% more likely to be obese. They are 60% more likely to smoke. They're over 2.5 times more likely to develop diabetes. So already you can see there's a number of things that are sort of weighted against this particular population. Let's talk about some social determinants of health and how that affects people with disabilities. So people with disabilities have double the unemployment rate among those within the workforce. And that's a key phrase at the end, among those within the workforce. This is not talking about people that are unable to work because of their disability. We're talking about people who have a disability who are active members of the workforce. And the unemployment rate typically is double that of those that do not have disabilities. And that tracks pretty much regardless of what's going on in the economy. So when the economy is doing well, the unemployment rate is still about double. And when it goes, when the economy is not doing well and unemployment rates go up like it did during the pandemic, and you've got, rates around 10%, well, usually then it's going to track around 20% for people with disabilities. So it hits that community that much harder. About 35% are more likely to have less than a high school education. And people with disabilities are also less likely to report sufficient social and emotional support to meet their needs. In terms of disability across the lifespan, I include this, this particular slide for a couple of reasons. Number one, to give credit to all the statistics I just quoted. They come from the article that's referenced on this particular slide at the bottom by Gloria Cron, who was formerly with CDC and as the, I think at Oregon State or University of Oregon, one of the two, I'm sorry. Wrote this article on persons with disabilities and unrecognized health disparities as a population that's in the American Journal of Public Health. And all the reason I put this particular slide up is to show how disability progresses as people get older. So there are really two different types of populations when you're talking about people with disabilities. You're talking about people that have a disability from birth, like myself, or you'll have people that have acquired their disability earlier in life. And then you'll have people that age into a disability. So there's two distinct populations, those that either are born or acquire disability early in life, or those who age into a disability. And people who age into a disability usually have a much different view of their disability than those that have a disability earlier in life. People that age into a disability are going to be much more, I would say, they're going to accept it as part of the aging process and not necessarily view and view a loss of independence as a result. Whereas people with disabilities who have had disabilities their whole lives look for ways to try and maintain independence regardless of their disability, and are going to have a different expectation as it relates to what's available to them. And that's going to be very important when we're talking about virtual engagement, because it does become then, one of the most common things that happen to people when they get older and they age into disabilities. They're aging into disabilities that are going to affect sight and hearing. And as a result, they might not have the same expectations as someone that lost their hearing or lost their sight early in life or were born deaf or blind. And as a result, they will not have those same expectations as to what should be provided to them when they are participating in different processes. So it's just something that's important to keep in mind when you're talking about virtual engagement, because it does become a relevant factor in terms of what people expect. And those people that are older, they're going to be like, well, that's just what happens when I get older. I guess I can't participate in these events anymore. Whereas someone that's younger is not going to have that sort of same approach. So let's talk a little bit about accessibility and etiquette and understanding exactly what that means in the virtual world. As an organization, we do a lot of outreach on accessibility and making sure that things are fully accessible when people are hosting events. And this predates COVID. It's been something that we've done as an organization since we've been around. And this particular slide is a slide that I've used numerous times in various presentations I've done to sort of highlight some of the areas that people need to think about. What is different about the slide now is for virtual stuff, I've started bolding the last 3 bullet points, because this is really where we're living now. When you're talking about virtual engagement, you're not going to worry about whether your parking lot's accessible or your building or elevator and restrooms and all that kind of stuff are accessible. But you do have to, it does raise a whole nother level of accessibility and how it does interact with the disability community, and making sure that some of these things are available to people so that they can fully participate in these kind of events. So we're talking about alternative formats, which includes Braille, large text, audio formats, and digital formats that are screen readable. Also, packaging and messaging of materials, making sure that they are fully inclusive of people with disabilities, that people with disabilities are represented in those materials, and also specifically talking about how it is, how it's packaged to people so that they know that their needs are going to be met, that they know that there's going to be alternative formats available if they need those, and that they're done in a way that is fully accessible. And I'll talk about that in just a moment. And then finally, font size. For people that have low vision, they usually want larger font sizes on things so that they can see things, and making sure your presentations and the like are done in a way that is fully inclusive. So let's talk about accessibility in a virtual world and what it means. Already said alternative formats for printed materials are needed. And most people immediately think, well, that means Braille, but that's not necessarily what it means, especially in a virtual world. That's not what it means. What it means is having documents that are can interact with the screen reader. You'll hear the term 508 compliance. 508 compliance is basically a way of talking about making sure that all of your online materials can be interacted with an online or a screen reader. A screen reader is what someone with who is blind or low vision uses to interact with their computer. It reads everything to them. Well, if things aren't coded properly and are not set up properly, they are either going to not be able to interact with the document at all, or they're really in a struggle to interact with the document because it's not set up properly. So making sure that that is done correctly. And there are organizations that do that. As an organization, we have someone on staff that sort of has a specialty in this area and just understands exactly what needs to go into that. We also talk about allowing for alternative means of participation. So allowing someone that is participating in an event, allowing them to be able to maybe come in a different way. It might mean, opening up a phone line if you're on something, or it might mean, making sure that other folks, that they have the ability to communicate in ways that maybe are non-traditional. Including alt text and online images. And this goes back to the screen reader. Alt text is basically when there's a photo in on a website or something like that, alt text basically reads a description of what's in the photo to someone who uses a screen reader. Making Zoom accessible. There's a few ways we can do this. Number one, you can add captions, and I'll show you that in a moment, how that can be done. You can also use ASL interpreters who can be part of the panel, and they can be, someone can highlight them if they really need to look at them to be able to see what's going on. So you can have ASL interpreters as part of what you do. And also screen sharing. When you're screen sharing, making sure you're explaining what's on the screen for people who have vision disabilities, and so they understand exactly what it is that they're seeing, and allowing people then to know exactly what it is. And we always say, be flexible. Make sure that you're doing your presentation in a way that's going to allow some flexibility. We had the poll earlier, which is a great thing. And screen readers have been, they've worked with making sure that screen readers can interact with those. But sometimes people want to do something outside of Zoom and put it up on a shared screen. Then it becomes a little more problematic. And how do you do that? And using the chat function as a way to communicate with people, because screen readers do read what's in the chat function. So it's another way to sort of make people be able to participate fully. And the way you do that is you ask people ahead of time, what do you need to be able to fully engage in this? What accommodations do you require? And letting people know that. If you are interested in doing captions on Zoom, I can tell you a couple quick things you can do. Zoom has really improved its capabilities for its auto-generated captions. And the way you do that is, I've highlighted here, if you go into your Zoom settings, there's an advanced setting for closed caption. You have to make sure that it is turned on with this little blue button that's right here. And also that this blue box is checked, enable live transcription, which allows it then to do the automated transcripts. Then when you get into the actual presentation, what will happen is you'll have a live transcript button as the host, and you click that, it gives you options, and you can enable auto transcription for the automated transcript. And they've gotten much better. The AI has gotten a lot better to be able to interact with that. And it also then allows you, if you want to have a captioner participate and actually do it themselves, because they can do it with much more accuracy, you can assign the participant to type and assign the captioner to do it. I would consider that the best practice, as opposed to using the auto transcript, because the auto transcript isn't going to get everything right. They're not going to get acronyms right. It still struggles with the word COVID and things like that. So and also if someone has an accent, sometimes it's a little harder for it to pick up on things. So best practice is to assign a participant to do it and get a captioner ahead of time and pay for that. Couple quick resources, because I know I'm running out of time. Since this is about COVID, I did want to highlight 2 studies that we did. We did a COVID and disability survey at the start of the pandemic. It was a snapshot, sort of where people were, some of the things that they were, lacking in terms of what they needed and the like. You can read about that at the link that's on this slide if you're interested in that. And then also, if you want to, in terms of, we have a COVID-19 vaccine survey that we did earlier this spring. You can go on and read about that. It talks about how people were doing at the time with people with disabilities were doing with vaccines, whether they had been vaccinated, whether they were going to be. And I just have the bar graph that highlights that particular result that we have in there. So I'd encourage you to check those out if you're interested in learning more about that. I am not the researcher that did that, so I can talk about that in a limited capacity, but if people have questions, I can try and help on that. And then finally, if you are looking for more resources on doing things with disability, etiquette, and accessibility, we have an etiquette fact sheet that we had done for our NDNRC project that Joey mentioned when he introduced me. And then also we have several documents that we've done on outreach to people with disabilities. And among them, the one I have there at the top is really a virtual platform accessibility tip sheet, going over a lot of the things I just talked about and sort of what to be thinking about. It's not a document that's going to give you all the answers, but it's going to get you thinking about what you need to think about and giving you the directions on where to go for that. So at this point, that's the end of my presentation. That's my contact information. Feel free to reach out to me via email if you have any questions.